Good afternoon. Thanks a lot for taking the time to be with us this afternoon for the first webinar we organized together with BASC. We hope it will be a long series of fruitful and innovative webinars. Why this webinar is, first of all, a partnership between two organizations, HOPE, the European Hospital and Healthcare Federation, and BASC, both devoted to the quality and safety through different methods, different goals, but the same eagerness to be useful in this field. Why a network? Why we decided actually to have this network? We met on many occasions. We organized in HOPE with HOPE members several study tours, sort of short period of time spent in the country to discover the quality and patient safety issues. We also had last year a very interesting conference called the HOPE Agora 2018, where quality was also at the center, but with a specific angle. Experience and competencies of patients. What we want to do around this idea of sharing caring is, as we have been doing in HOPE since 1966, we're trying to share best practices, or at least good practices and experience, considering that it's the most effective ways to improve the health systems on one way, and also more specifically the quality of care and dealing with patient safety issues. Why also this? Because there's a sort of opportunity, which is a missed opportunity in a way, is that at present time the European Union institutions are not so much involved in this, although they were in the past, with the joint action patient safety and quality in particular. So we suggested, together with BASC, to create this network, sort of structured network, starting by this webinar and following by other webinars exchanging good practices. So the resources is quite simple. We have in HOPE 36 national organizations in 30 countries, and they have their own networks, their own specialties, quality and patient safety expertise, and so on. On the other side, BASC, based here in Brussels, has expertise and resources much more focused on the patient safety and quality than us at the central office of HOPE. Our mutual goals are listed here. We want to create or reinforce the existing links between different organizations that are working on patient safety and quality in Europe. Also strengthen the visibility and the image of this organization and of HOPE and of BASC together. Increase the learning opportunities and share best practices. Again, there are several ways to do this, but we thought that this would be an additional useful way to learn more about what others are doing in Europe. And in the long term, we hope that with those activities, starting with webinars, we will be able to implement common projects in different European countries, again, as we did through the joint action, patient safety and quality. The practical aspects, we will gather on a quarterly basis by means of these educational webinars through this video communication Zoom and testing it again today together with you. Hopefully it will work well and be useful for all of you. So first, the webinars will be limited to a presentation of carried out actions and projects by the members of HOPE and BASC. And gradually, the objective of the webinars would be to present more in details a best practice or an innovation, and hopefully to facilitate its adoption by others. We have already thought about the next steps, the next webinar. So this day is on TeamSTEPPS. The next one in September will be around certification and accreditation system with colleagues presenting it from the Vienna Academic Hospital, University Hospital. the largest hospital in Austria. And then in December, we'd like to focus more on medication safety with the MEDI project, in which we are involved as HOPE, part of the Horizon 2020 funding. So thanks again for joining us. This is just the beginning, but we thank you at the beginning. And I leave the floor to Laure for the presentation of TeamSTEPPS.
So we had some people having some sound problems, so I hope this is okay by now. So if there's any problem, I think Pascal maybe can try to just say to reconnect. Sometimes just reconnecting and then you'll be curious. So hope everything is okay. Today I'm gonna have a little short presentation with you guys about the Belgian TeamSTEPPS pilot project. Just a few words before, who am I? I'm Laure and I'm Quality and Safety Officer for PACS. So I'm in charge here of the TeamSTEPPS pilot project, but I also work on patient involvement, patient experience, and also on the long-term care facilities here in Belgium. So I said I work for PACS, just to situate it. We're an organization that has been created 5 years ago, and we're dedicated to quality and patient safety. You could link it to the Danish Society for Patient Safety or other institutions that are national about quality and patient safety. So PACS, what does it mean? It's a platform for continuous improvement of quality of care and patient safety. It says it all. We do work with everybody of the health sector. So we have the hospitals, the healthcare institutions. We work with the physicians, nurses and pharmacists associations. We have the health insurance funds working with us also. We are funded by the regional authorities, so we really represent the sector, and we do have some work with universities, and most of all, we work with patients in every of our projects. So we really work together for quality improvement, because we really want to promote, support, and organize initiatives of continuous quality improvement and patient safety in our healthcare institutions in French, Belgian-speaking country. What do we do? So we have programs, pilot projects like the TeamSTEPPS that I'm going to present today. We do have some training going on. We have resources that we share. What we work on, if you're interested, so we work on TeamSTEPPS. So we also have projects on safe surgery, infections, patient identification, patient experience, like I just said. We're working on really various things. What we do, we work together on a Belgian level, but we also try to work with partners and networks internationally. So you can see here a lot of institutions we're members of, or we partner with, we collaborate with. It's a really big scope. It's not representative, but we do try to work with everybody to improve patient safety. So I talked about resources and tools that might be interesting for you too. So we have our website that is in English. PACS.be. We have an English newsletter since 2 months, so you can stay tuned to our activities. We do have some English summaries of our magazine, if you're interested. Every quarterly publication, we have a toolbox online where we reference every tool you can find on patient safety. It goes from the HAS in France to the IHI in the United States. So we really try to put everything in one space. Since shortly, we also do a literature review for our hospitals. So we have summaries of interesting articles that we provide. We do have also an activity about adverse events sharing. So hospitals sharing adverse events with us. We analyze them and we share the best practices that can be learned and shared. And we do also have homemade guides and tools you can consult. Last but not least, something I had to say from the communication team here at PACS. We are organizing a big congress on the 3rd of October. As you can see, we have top speakers coming. So we have ISPA, Accreditation Canada, Canadian Patient Safety Institute, the Danish Society for Patient Safety. So a lot of big names that are coming to talk at our congress here in Brussels on the 3rd of October. So feel free to join us on this big day. So now for the 40 minutes I have left, I'm going to talk to you about our Belgian pilot project. So first of all, I'm going to talk to you about what is TeamSTEPPS, how did we roll out the project here in Belgium, and what are the first results that we have achieved here in Belgium about TeamSTEPPS. So TeamSTEPPS, one of the topic PACS wanted to work on was teamwork. So our approach is really to have the expertise at PACS to work with the professionals and go and search in the literature review to really teach and learn everybody together. So why did we choose TeamSTEPPS? So for those who don't know TeamSTEPPS, this is TeamSTEPPS. This triangle, this pyramid is really what is TeamSTEPPS about. So why did we choose TeamSTEPPS? Well, it was developed by the Agency for Healthcare Research and Quality in the USA. It really is a powerful solution for improving performance and patient safety. We found it was an evidence-based teamwork system that improves communication, teamwork, behavioral skills, attitudes, and knowledge. And it was also rooted in literature. So we really thought it was a good conceptual framework to work on teamwork and to test. Why also TeamSTEPPS? Because it's free, ready-to-use materials. That is really a big positive point. It has integration of teamwork principles, and it has actually just a training curriculum you can access. So here on the table you can see there's 3 types of curriculum. One presentation you can give in 2 hours, and then the TeamSTEPPS master training that you can give in 2 days, which comprises of fundamentals and a training coach course. So everything you can find in TeamSTEPPS is basically this. This is a training curriculum that you can teach to your hospitals to implement this pilot project. I'll be quicker about it. Why TeamSTEPPS? Well, it has been proven that it has given higher quality and safer patient care, but how? Well, it really works on the teams in the hospitals about the use of the information, communication, the people, the resources to achieve the best clinical outcomes for patients. They try to increase team awareness, clarifying the roles and responsibilities. Resolving conflicts is also a big issue in TeamSTEPPS, so it's really kind of a whole package deal. And it also is trying to eliminate barriers to quality and safety in terms of communication. So it was really a good package. And so what makes up team performance for TeamSTEPPS? Just a brief introduction to TeamSTEPPS. So if you take back the pyramid, so you have a patient care team. This is all about TeamSTEPPS. So patient care team. Every team member has knowledge. He knows what he's doing. He has his specialties, his experience. But you also have the attitudes of the team member. That is really what affects him, how he feels one day, not really will be feeling another, something else. So really these attitudes. And you have skills in a team environment, and those are the skills that you can teach. And this is what TeamSTEPPS is about. You can really teach those 4 skills: so situation monitoring, mutual support, communication, and leadership. And TeamSTEPPS is all about this. You have modules about leadership and those 4 skills, trying to give tools for the professionals to use, so that they can use their knowledge and attitudes to have a shared mental model. They trust each other, and you have a team organization. Why do you want to do this? To have performance. So this is the top of the pyramid, so that your team works efficiently, can adapt, can be productive, and can also provide safe care. So this was TeamSTEPPS in one slide, really short. But it's a really interesting model that really connects everything to everything. Going back one slide, just to make a connection. What is performance? This is non-healthcare. Maybe some of you have already seen this video, but I just invite you to check out the video. It's really short, but this is what you want to do in your hospital. You want to have a team that is performance, that has a shared mental model, that has mutual trust, and has the same goal. Okay, so really not healthcare related, but this was a performance, efficient, safe teamwork with mutual understanding. And I want to point out one little thing is that you have this guy who is picking up something where the car is gonna drive on, and this is about safety. So you really have a team working with one goal, is to have the shortest time ever to change 4 tires for enabling the car to just get started again and race against the others. But see how this guy is just picking up something, creates mutual understanding and a safe environment for others. So TeamSTEPPS is really about this, creating a team that has mutual goals and wants to perform right. And you should know that in this environment, they can't talk to each other. So you really have to know everybody's responsibility and roles. So it's really interesting how you can relate to other situations. So TeamSTEPPS, this is also in one slide what you can expect from TeamSTEPPS. I'm not going to go over all, but it's basically TeamSTEPPS. Within the courses you can follow, you will see all the barriers to teamwork. They will provide in the yellow spot the tools and strategies you can use. So for some who know SBAR, well, this is also integrated in TeamSTEPPS. You talk about debriefing and other tools you can use. And the outcomes you can accept is what I've just been saying, is that you should have a shared mental model, you can adapt, you want performance, and you also want patient safety. So this is TeamSTEPPS. It has a 3-phase implementation. So if you want to try TeamSTEPPS in your institution, well, TeamSTEPPS provides a pre-training assessment for site readiness to be sure to try and start TeamSTEPPS in an environment that is positive to it. Then basically it's just training for the on-site healthcare staff. You have to train your people in all the tools and strategies that TeamSTEPPS can give. And then you have the implementation and sustainment phase where TeamSTEPPS also provides some of the interesting strategies. So this was TeamSTEPPS. This was something that PAX wanted to try. So we started a pilot project. So as you can see, PAX is a sort of an institution at in French-speaking Belgium, and we work with organizations. So what we did in the start, a preparation phase, we went to search in the literature and see who has already did TeamSTEPPS in French-speaking part of the world. Because you have to know in Belgium we speak French and Flemish, but French-speaking hospitals have a little more difficulties with English, so we wanted to translate everything in French. It was a huge work, but luckily for us, the Federation for the Hospital of the Canton Vaud, I can say correct, the Swiss organization, has already translated it, and so we started a collaboration with them. What did we do? I also went to the United States to follow a TeamSTEPPS master training to really get to know the TeamSTEPPS package and have everything, all the tools and all the pocket guides that the TeamSTEPPS provides. Really interesting. It's a whole package deal. So I did the master training. Thanks to the Swiss team, we had access to already translated course material. You have some slides, some videos, the pocket guide, all the evaluation tools we had to share also. And then, well, we did a favor back. We translated some additional resources that weren't translated yet, and so there was a collaboration also on that point. So now that we have all the French tools and resources needed to put in practice our pilot project, this is how we did it. So in September 2017, we organized an information session where we explained what the pilot project would be for the institution. We gave all the documentation and surveys they could have needed to join the initiatives. By the end of the month, we asked for an engagement from the hospitals who really wanted to work with us. And then we gave them 3 months time to really go back to their institution and identify a pilot unit. So there's some documentation available for them. It's in a self-evaluation survey. They could do the safety culture measurements also in their units to see, okay, this is a unit that could be potentially interested in joining this initiative. And then by December, we had the deadline for application. We put us a maximum 10 institution limit because in terms of support, it was also a maximum for us. So after this, we had 6 participating institutions. So this is Belgium, for those who don't know Belgium. So the French-speaking part is, you can see the heart is Brussels, and then the south region is Walloon. So these are the institutions that agreed to participate. For your information, the pilot project was free for every institution. It was on a voluntary basis. It was not imposed. So we're within the 60 hospitals that there is in French-speaking Brussels and Walloon. There were 6 participating, so good enough for us. So we had 6 institutions participating, and we organized, according to TeamSTEPPS, a master training of 2 days, where we asked 3 members of each institution to participate in the training with multidisciplinary profiles. So TeamSTEPPS asked from the institutions that want to try TeamSTEPPS that you at least have a nurse, a doctor, and maybe somebody from the board or the leadership role. So you really have a representative change team for a master. So we did the master training. As I was alone here in PAX for the master training, we had support from the Swiss team. They came over to Belgium to teach our hospitals about TeamSTEPPS. So we had the requirements of the 3 master trainings in order, and we had the multidisciplinary profile. So we had a doctor, a nurse, and then Anthony Sainz, I think he's listening, was also there to co-organize the TeamSTEPPS master training, sorry. So we did this training, and basically after this, it was the start of the support by PAX. So how do we work? The pilot project is to be ended in 2019, and what do? We have a collaborative approach in each of our pilot projects. So we organize learning sessions between the hospitals, where they share procedures, they share their experience and results, they identify best practices. And the idea is then, by the end of the pilot project, to publish recommendations for others. So it's really a Belgian pilot project, so we have Belgian institutions participating, and the idea is to publish recommendations to other hospitals who maybe want to use TeamSTEPPS and to see, okay, in our Belgian context, what is something we have to share and be attentive of if we want to implement TeamSTEPPS. This collaborative approach is based and inspired from the Breakthrough Series Collaborative of the Institute for Healthcare Improvement, which is actually just having a lot of learning sessions, so meetings, once every 3 or 4 months for the institution to come together and share what they've done. So this is the roll-up of the project. We started in January 2018 and it's ending this year. So what did the institution do? First phase was training. They had to train the pilot units they had identified to develop the action plan and maybe also choose 1 or 2 tools from TeamSTEPPS they wanted to implement. They implemented, they're still doing it, so that is a good sign. And what we did is, well, during the learning session was talk about the follow-up and the eventual measures they could use to check what's going on. And like I said, by the end of the year, we're going to have a publication about what recommendation you can have about TeamSTEPPS. 1.5 years later, what are the results? So for PAX, we had 3 follow-up meetings. If you count the years, we should have had at least 4 or 5. But TeamSTEPPS is really about changing a culture, which is kind of difficult, you might all know. So we only had 3, but that was necessary and just sufficient for the institution, because if there were more, they couldn't have shared enough. So what did they share during those learning sessions was really obstacles and problems encountered, going from I don't have the money to print some things, or I don't have support from leadership. How did you do it? And really, they were really open and transparent about everything, and they shared ideas and experiences. So that was really a good positive point. And we do also have at PAX level, My PAX, which is an online working, learning, and sharing space where you can share documents, where we provide also all the video materials TeamSTEPPS provides, the PowerPoint templates, the brochures, well, everything they want to share, they can do it on this platform, and it really is a resource they can use. About those learning sessions, so we at PAX level evaluate them, and you can see we have an 8.8 average for our 3 learning sessions, so really positive. You can see the few comments so that somebody said it was really enlightening and instructive about the sessions to talk with other institutions. So really interesting to have those learning sessions about the rollout of the project. You want to ask me, okay, what are the quantitative results? What did you achieve? So like I said, we had 6 participating institutions. We have 3 in green. A little detail, so if you take the first on the left, they try to implement TeamSTEPPS in 9 units. They only have 3 master trainings, but they're training TeamSTEPPS like hell. So they have a lot of staff that is already trained. When you go to the second hospital, it's a university hospital, where you see the numbers going up because there are a lot more people working. And it's a hospital-wide project. So they didn't decide to do it in just 1 unit, they decided to do it a hospital-wide project because they're in an accreditation with GCI. So they crossed the projects and said, this is an opportunity for us to work on communication. The third institution, also 100% of the staff is concerned, and it's in one emergency department. And you can see that's going on. We have 1 psychiatric or mental health facility working with us. They're in yellow because they had to start over. One of the difficulties was that the initial master trainers dropped out. So we had to, as PAX, reorganize the master training with them in order for them to reboost and try to do it again. And so now they have 8 master trainers, and they have on-site training scheduled. For the 2 remaining institutions, so they have their action plan, they have everything in standby. The only problem is leadership and funding or other priorities. So they're on standby, but they have really good ideas of projects. So this is on standby. This is hospital way of living. We can't change that, but they were eager to participate and still want to. So they hope they will one day be able to go on active status. So about the recommendations, we had 3 learning sessions with the institution, and this is what they put forward. So I'm going to start at the leadership support. This is unilateral recommendation. You have to get the leadership to support the project, otherwise it won't work. You won't have financial resources if the leadership isn't with you. So it's kind of goes with them. Something about the TeamSTEPPS training you can provide in your institution. They said perfect manner to do this is doing it in a mixed way. So you have to, for doctors, for instance, it's easier to have them with e-learning, and for nurses to have them in person, and then have some simulation about the tools that TeamSTEPPS has to get them together. So they said this is the most effective way to train the most people you can. You have, during the training sessions, the ones who give the training session has to be multidisciplinary. So this is something TeamSTEPPS says, and you have to do it, but they underline it. They say it's really rich to have different profiles during the training sessions. Also something about the trainings, you have to cast your master trainers, so somebody who has already experience with presentations and giving classes is really positive. So this is something you might want to consider. You have to involve the medical staff. It's always a difficult point, but this is really important. So if you want to try TeamSTEPPS in your institution, try to do it in a unit or department where the medical director or the medical head is really up to it and motivated. That will spark TeamSTEPPS in the institution. They also talked about including TeamSTEPPS in the continuous education program of the institution. So that it really goes into the culture of the institution, that everybody that enters the institution, for instance, a new employee, has some notion of TeamSTEPPS. This is something they thought about. We work with the communication service because they can really roll out information in the whole institution. Another thing is that you have to measure and follow up. That goes for sake, of course. And then something really interesting is that TeamSTEPPS provides a lot of materials, PowerPoint templates, but they said the most important thing is to personalize it, because otherwise you just slam some presentation at your staff and they won't understand it. And they say, well, you really have to personalize it. Use the logos of your hospital and really relate it to what you're doing in-house. And one of the most important things they put forth was the assessment of needs. Before you start TeamSTEPPS, really do an assessment of what you need in order for an institution to really choose the tool or the strategy they want to implement. For them then to have the real engagement of the staff, of the leadership, and of everybody that is on board of TeamSTEPPS. So this was a quick view of what we're going to publish probably by the end of the year. But it's really interesting. That is a whole package of interesting things. What did the institutions do? So I talked about personalizing TeamSTEPPS. So our institution developed a lot of tools and resources. So like I said, TeamSTEPPS provides a lot of videos, like the one I showed from the car. Well, our psychiatric institution said, well, TeamSTEPPS also provides a lot of videos about acute settings, but it doesn't relate to psychiatry. So they are doing right now videos, capsule videos, and they're in production. They're trying to find actors in their staff in the institution to really try to do some videos. They have educational templates, posters, notebooks. They do some video conferences. We have an institution who has also developed an e-learning. So yeah, the institutions are really appropriating TeamSTEPPS, and that's really interesting about it. What brings the end of 2019? Like I said, we're going to have maybe one last learning session in November 2019, just to see where our institutions are. We're going to publish the recommendations report, and we're going to ask also our institutions to evaluate final projects. TeamSTEPPS said that the patient safety culture measurement from the RGQ ARC is really a good one, so we're going to ask them to measure it in their selected units to see if the TeamSTEPPS has really had an impact on their patient safety culture or not. And maybe for the future, why not have a follow-up with our online platform, or have an annual learning session to have this kind of TeamSTEPPS community in Belgium? And why not organize a second TeamSTEPPS rollout? Because I have had several hospitals here in Belgium asking, are you going to organize TeamSTEPPS again? So maybe this could be something we're going to do here at PAX. To conclude in a nutshell, say yes to TeamSTEPPS, because it's a full package of resources and implementation strategies. It has been translated also in other languages, so feel free to ask me. I can give you the list of languages, so not only in English. For an institution, if you want to say yes to TeamSTEPPS, something that's really important is that we have to have motivated change team and master trainers who dare to lead in TeamSTEPPS. And know that if you implement TeamSTEPPS, literature has proven that it has an impact on teamwork, on culture, and on patient safety. And for PACs, for institutions who are listening maybe with us that are in the same mission, that have the same mission and vision as us, see TeamSTEPPS as a long-term project. Like I said, we plan learning sessions every 3 or 4 months. That was too short. So maybe considering a really long-term project on 2 or 3 years. And then this is something I do, but really motivate institutions to measure. Otherwise, it's just giving training to staff and hope to see that something's going to change. So this was, in a nutshell, our pilot project here in Belgium. I hope everything was interesting and clear. Thank you for your attention. If anybody has wants to join us back in September, here's the invitation. I will send it to others.
Some of you arrived in the middle or part of the webinar. So the webinar has been recorded, so it will be available soon. So we will provide to you all the information where to get it.
Okay, I see everybody's chatting by saying they have no questions, so that's good, thank you. So if everything's okay, well, I'm going to close up now. I'll be sending everybody the link to the video, so my PowerPoint presentation and my contact details if anybody has further questions for them. If not, well, thank you. And
we thank Laure for her presentation. Thanks a lot for this first webinar of PACs.